Hey folks, Dr. Jeff Williams here again from Amarillo, Texas to discuss with you one of my blogs called An Improved Approach for Whiplash Injury Treatment. Now this blog is based around a research paper from 2004, and the paper was called Dorsal Manipulation and Whiplash Injury Treatment, a randomized controlled trial. The paper was published in the Journal of Whiplash-Related Disorders and performed by Fernandez de la Penas et al. Hope I got that right. So it's common for chiropractors to see car wreck victims, spinal injury, spinal manipulation, musculoskeletal disorders. That's just what we do, so it's only natural for us to be treating these people. In fact, I'd say that you're missing the boat if you're not checked by a chiropractor experienced in a whiplash injury after you get in a wreck. It's common for us to see people that were fine in the beginning, but then the pain kind of gradually crept in and came in over a month or two, and at that point it was much harder to deal with. So just go get checked if you end up in one, okay? That's all I'm saying. Payment for car wreck injuries is normally done through the other person that hit you, through their insurance, which we call third party. The payment may be made through personal injury protection on your own car insurance. This is also known as PIP coverage, and you pay for it, so use it. I commonly have people say, well, it wasn't my fault, so I don't think I should have to pay for it. And I think, well, if you're riding in a bus and you get sneezed on and you get sick, are you getting that person's insurance to cover it? No, you pay for your own insurance, and in this case, PIP coverage. Use it if you need it, okay? Another option to get checked out after a car wreck is to simply have it covered through your own general health insurance. When a patient feels it's appropriate, many times they consult and maybe even hire an attorney who then will issue a letter of protection to the doctor's office, essentially guaranteeing them payment on the treatment. So many times there's lots of options, and there is usually little to no cost to the car wreck victim for treatment. Okay, so let's get on to the research. Why did they do it? The authors felt that there was a vacuum in the literature concerning the frequency and level of efficacy of mid and upper back manipulation in whiplash cases. The goal of this paper was basically to determine the efficacy. You say that 3 times. The goal of this paper was to determine how effective manipulation to the mid back and upper back could be in that context. Here's how they did it. There were 2 parts to the study. The first part of the study consisted of 120 patients that had just regular mechanical neck pain. There were also 120 patients that were diagnosed with whiplash. So here's the hypothesis they were testing. Are there any differences in the prevalence of mid and upper back joint dysfunction for those having been diagnosed with just regular mechanical neck pain as compared to those diagnosed with having whiplash? Now, the second part of the research paper consisted of 88 patients from the initial 120. Now, these 88 were divided randomly into 2 groups, Group A and Group B. Group A was the experimental group, Group B was the control group. Now, Group A underwent treatment consisting of thoracic or upper mid-back manipulation and physiotherapy techniques, which are commonly used at chiropractic offices. The adjustments occurred at the 5th visit and at the 10th visit. Now, the Group B underwent treatment consisting of only the physiotherapy techniques. Now, the outcome assessment included the visual analog scale, also known as the VAS, V-A-S. Data was collected before treatment commenced, after the 10th session, and after the 15th session. Okay, now that was a lot of information, but stick with me. Here's what they found. They found that in the first section of the study, 69% of those diagnosed with whiplash also had thoracic or mid-back dysfunction. Only 13% of those with regular mechanical neck pain had associated mid-back dysfunction. For the other part of the paper, the experiment group, or the chiropractic adjustment group, they had a more significant reduction in their VAS score than did the physiotherapy alone group. The results were most noticeable in the intensity of neck pain after the second adjustment and in the back pain after the first and second adjustments. Pretty cool. Now, let's wrap that up and let's make sense of the whole thing. Mid and upper back dysfunction occurs very frequently, roughly to the tune of 70% of the time, in conjunction with whiplash. Now, this research paper proved that chiropractic manipulation combined with exercise and therapy is more beneficial toward the outcome than exercise and therapy alone. So there you have it. If you or someone you care about was in a car wreck, get to the chiropractor. That's simple enough now that research has shown you the proof. And that's just another reason to call a chiropractor today. Research and clinical experience shows that in about 80% to 90% of headaches, neck, and back pain, in comparison to the traditional medical model, patients get good or excellent results with chiropractic care. Chiropractic care is safe, it's more cost effective, it decreases your chances of having surgery, and it reduces your chances of becoming disabled. Now, we do this conservatively and we do it non-surgically. In addition, we can do it with minimal time requirements and minimal hassle on the part of you, the patient. And if the patient develops a preventative mindset going forward from initial recovery, we can likely keep it that way while raising the general overall level of health. Now, please feel free to leave a comment. Tell me your thoughts. I'd love to hear what you think. And share. We can't make a difference without your help. Be sure to find us on social media sites like Facebook, Twitter, Google+, Pinterest, LinkedIn, Snapchat, and Instagram. Also, be sure to subscribe to our YouTube channel. The link is in the description, or just hit the subscribe button. At the very least, can we talk you into giving us a thumbs up below? Something that simple and quick really helps us to get in front of more and more people that are looking for this kind of information. Till next time, Dr. Jeff Williams, Creekstone Integrated Care, right here in Amarillo, Texas. Thanks for watching. Thanks for sharing. See you next time.